Different families look for different things, and they usually enter the room completely shell-shocked and not knowing what to look for. Only minutes, hours or days before, they were expecting a perfect normal baby in a few months' time. And they're suddenly being told that, we're very worried about your baby. Well, they don't know what a neonatologist is, because you don't plan on neonatal intensive care when you get pregnant.
Some families make the difficult decision not to continue the pregnancy. We offer an alternative whereby we feel that the family can be supported. The baby's outcome may not be what was planned for, but we feel that that's precious time that the parents can have whilst the baby is in utero, and sometimes for an undefined period after the baby's born is a very precious period, a very important period sometimes to have some bonding, some contact with their child.
The bittersweetness of loving a child who dies, parents often find that they have courage and strength that they never knew they had, and the child then goes on in the future to actually be an important part of their lives. It's almost like the legacy of that child then is lived out through the parents' lives and the siblings' lives.
Oh, there goes Reuben, and that was our son. And we were going to love him just like we'd loved all the others, and we wanted to cherish every moment that we were going to be able to have.
Couples at first, they're in a situation that they've never been in before. It's all new information. Majority of our patients do not have a medical background, so they're in very unfamiliar territory. So providing them information in layman's terms can be very helpful with their coping mechanisms and can empower them and give them back some of the control by providing them with, accurate medical information in a supportive environment.
There are many steps along the road to hold the candle in the dark for those families from the time of that diagnosis.
Almost like family having all these services and support that were there, because they're there to help people, and really you can only be helped if you let somebody help you.
It's our job to make sure that that child and that family get the best experience that they can out of it. And very often we're not dealing in a palliative care situation, so we have lots of optimism in the work that we do as well. But these families and their courage, they're a remarkable group of people to work with.
We do have the privilege of seeing ordinary people face extraordinary circumstances with extraordinary courage. And I learn from my patients.
Every day was a positive day. It was a positive, a happy day, positive day. Of course, when he passed away, sad.
This is one of the most amazing experiences that parents can have. I think it starts with a lot of fear, but what most parents that I've been involved with tell me is that they find this incredible strength. They live their own integrity often. They allow themselves to fall in love with their child and parent this child.
You're able to look back at, a plan that was put in place. So, and it was an incredible plan.